नमस्कार दोस्तों, स्वागत है आप सभी का किक्स फॉर आईटी चैनल में। दोस्तों, आज मैं आपको इम्बोलिज्म के बारे में पढ़ाऊंगा। सबसे पहले डेफिनेशन। इम्बोलिज्म, इट इज़ अ डिटैच इंट्रावेस्कुलर सॉलिड लिक्विड गैसेस दैट इज कैरीड आउट बाय ब्लड to different site from its point of origin. Now, type of emboli. Depending upon matter of emboli, it is classified into solid, liquid, as well as gases. In solid, it is thromboemboli as well as foreign bodies. In liquid, fat globules or amniotic fluid, while in gases, it may be air or other gases, etc. Depending upon whether infected or not infected, it is classified as bland as well as septic. Depending upon source of emboli, it is classified as cardiac, arterial, venous, as well as lymphatic. Depending upon flow of blood, it is classified as paradoxial embolus as well as retrograde embolus. In paradoxial embolus, embolus is carried from arterial side to venous side or from venous side to arterial side. It is vice versa. And in retrograde embolus, it travels against the blood flow. Now, pulmonary emboli, the site of origin is vein of lower legs. First, initially deep venous thrombi get converted into fragmented thrombi. Now these fragmented thrombi enters into the venous channels, and from venous channels it enters into the right side of heart. Depending upon the size of thrombi, it may occlude. First is pulmonary arteries bifurcation, small branching arteries. Now embolus may enters into the systemic circulation through paradoxial embolism. Now, what are the consequences? First consequence is most of the pulmonary emboli, that is 60 to 80%, are silent because they are small. Sudden death due to right side heart failure occur if 60% of pulmonary circulation is occluded. Due to dual blood supply, emboli in medium-sized arteries causes hemorrhage without infraction. Multiple emboli causes pulmonary hypertension as well as right ventricular failure. What is pulmonary embolism? Site of origin, it is veins of lower legs. Mechanism, deep venous channel get converted into the fragmented thrombi. Fragmented thrombi enters into the venous channels and it enters into the right side of heart. Depending upon the size of thrombi, it may occlude. First, pulmonary artery bifurcation, small branching arteries. Embolus may enters into the circulation through paradoxial embolism. Paradoxial embolism means embolus carried from arterial side to the venous side as well as vice versa. Consequences: most of the pulmonary emboli, that is 60 to 80%, are silent because they are small. Sudden death due to right-sided heart failure occur if 60% of pulmonary circulation is occluded. Now, due to the dual blood supply, emboli in medium-sized artery causes hemorrhage without infraction. Multiple emboli can cause pulmonary hypertension as well as right ventricular failure. Now, systemic emboli, most about 80% arises from intracardiac mural thrombi. Some as paradoxial emboli. They lodge in more than vascular beds that travels to wide variety of sites. And major sites are brain, kidney, spleen, intestine, upper extremities. What are the consequences? The consequences are vulnerability to ischemia as well as collateral blood supply. Now we came to fat and marrow emboli. The fat globules obstruct arterioles and capillaries. Causes of fat and marrow emboli are traumatic as well as non-traumatic. In traumatic, trauma to bones, trauma to soft tissue. And in non-traumatic, diabetes mellitus, sickle cell anemia, extensive burns, inflammation of bones and soft tissue. Now, mechanism of fat and marrow emboli. Free fatty acid, once released from fat globules, causes toxic injury to the endothelium. Now, this toxic injury to endothelium will lead to platelet activation as well as granulocyte recruitment. Then occlusion of arteriole and capillaries will occur. Consequences: anemia, thrombocytopenia, as well as pulmonary insufficiency. Now we come to air embolism. Gas bubbles within the circulation form frothy mass that obstruct the blood vessels, and very small amount of air get trapped during coronary artery bypass surgery. More than 100 cc of air is required to have clinical effect on pulmonary circulation. Now, amniotic embolism. It is a complication of labor, causes insertion of amniotic fluid into maternal circulation due to rupture of or tear in placental membrane. Consequences: cyanosis, shock, seizures, coma, headache, etc. Thank you for my watching videos. Have a nice day.